Welcome, everybody. So let's dig in. So why do providers forgive some of the patient responsibility? Well, financial hardship, as I state here, keeps many patients away from seeking care. So, for example, it's very common for non-participating providers. The patient wants to see a surgeon that's non-participating. The out-of-network deductible is typically $5,000. There's usually a 50% out-of-network cost share, right? So there's going to be a significant out-of-pocket responsibility for the patient. Now, if the provider waives part or all of that patient responsibility, the provider can incentivize the patient to actually get services from this particular surgeon, as opposed to going to an in-network provider where their patient responsibility would be significantly less. And the insurance companies know that. They know it's common practice for out-of-network providers to waive all or part of the patient responsibility. And that's why they do these fee forgiveness audits, okay? On the participating provider side, it's not uncommon for in-network providers to not collect co-payments, deductibles, and coinsurances, particularly for surgeries where the out-of-pocket could be upwards of $500 to $1,000. I will tell you right now, if you're accepting government plans such as Medicare, TRICARE, Medicaid, you should never, ever waive a patient responsibility for a government plan. Never, ever, ever. The government takes that very, very seriously, and you could be looking at civil or criminal sanctions. Not worth it, folks. If you're going to take Medicare, collect the 20% coinsurance. Okay, so let's talk about the federal plans, Medicare and the other federal plans. So what is the False Claim Act? The Federal False Claim Act prohibits knowingly submitting a false claim to the federal government. That statute doesn't require a specific intent to defraud. The intent is not required. So knowing includes not only actual knowledge, but also a deliberate ignorance or reckless disregard for the truth. So in other words, it's very easy to prove a false claim with respect to fee forgiveness. Okay, so a large part of what I do when I defend a client for fee forgiveness, it's mostly commercial plans. Professional courtesy, waiving charges for physician colleagues and their immediate family. These practices risk running afoul of the Anti-Kickback and False Claim Act. Remember I told you guys, do not waive balances for federally funded plans. I don't care if it's your wife or spouse. Don't do it. Now, on the commercial side, most of my clients have some sort of professional courtesy policy. It's permitted, there's a limited permissiveness for this kind of a policy under the law, but not in federal. So HHS emphasizes that physicians forgiving financial obligations for reasons other than genuine financial hardship and without good faith attempts to collect the balances may violate anti-kickback statute. All right, so just buyer beware. All right, prompt pay discounts. There is some credence to having prompt pay discount policies that have been accepted in some courts, but I don't recommend them for my clients. I just think carriers hate them, just like they hate financial hardship policies, and they view it as per se fee forgiveness. So, I'm not a big fan of them. Illegal inducements to Medicare beneficiaries in the form of free items and routine co-payment waivers can result in overutilization. We talked about that in the first slide, and waste taxpayer funds.